Welcome to Ask the Doc. I'm Kathy Buccio. Now, losing weight has been an eternal struggle for our species since the dawn of a man. And over the last 100 years, there have been countless fad diets, way too many late night infomercials, dangerous over the counter diet pills, and dozens of APPs guaranteeing weight loss through your smartphone. Now, unfortunately, none of them have been the magic bullet that overweight people were looking for. And that was until now. Today, we have Dr. Madeline Camejo, Chief Pharmacy Officer for Baptist Health, and Dr. Marissa Mauricio, Clinical Pharmacy Specialist at Baptist Health. And they're going to help walk us through the current wave of diabetic medications that are flying off the shelves and triggering shortages, as well as answer any questions you may have.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Welcome to Ask the Doc, the show where we encourage our viewers to send in their health questions. So let's kick things off with a question from one of our viewers. And today's first question comes from Vinetta. Hello, Vinetta, and thank you, who just reached out to us through our website, allhealthtv.com. And she asked, Dr. Camejo, I've been hearing a lot about Ozempic and the other weight loss meds, but I'm so confused. How do I know which one of them is best for me? Oh yeah, I guess the most important question is, do I have to be diabetic to get a prescription?
So Vanetta, thanks for asking that question, but let's talk about what these meds are. These meds are called glucagon-like peptides. That's why they're known as GLP-1s, receptor agonists. And they work by stimulating after eating, stimulating actually insulin while you're eating, and slowly move through your body and your stomach so that you make it feel like you're fuller, and it sends a signal to your brain to let you know that you're full after eating. So this is why it's utilized to help treat obesity. So Vanetta, if you're just about to lose 10 pounds to get into a bikini this summer, these meds are not for you. Now, to answer your question, you don't have to be a diabetic to be on weight loss medication. Wegovy, Zepbound, and Saxenda are the new GLP-1 medications that are indicated for weight loss. Ozempic, Victoza, and Mounjaro are the GLP-1s that are indicated for type 2 diabetes. Now, to know which med is right for you, first, you're going to have to visit your doctor so that he can properly assess if you're a candidate for these medications. And then you will need to determine how overweight you are by measuring your BMI, which is your body mass index. So to start on this medication, you must have a BMI greater than 27 and have at least a weight-related issue like, let's say, prediabetes or high blood pressure or high cholesterol. Or if your BMI is greater than 30, then you are in the obese range and you will automatically qualify for this medication. But it's your doctor who will determine which is best for you.
I have a feeling we're going to be getting some great questions today's Dr. Camejo. So Esteban just sent a question to us to our YouTube page. And Esteban asked, Dr. Camejo, I'm a big guy, like offensive lineman big. I'm definitely overweight, but how do I know if I'm considered obese? And do I need to be obese to get these meds? Okay, offensive lineman, okay, that's pretty big. So this is a great question. So do folks need to be obese, Dr. Camejo, to get a prescription?
Well, Esteban, thanks for reaching out. And Kathy, I know some pretty big guys who are not obese and they're very fit. But I'm going to punt this one to Marissa. Marissa actually sees a lot of athletes, high-end athletes in her clinic. So I'm just going to say, Marissa, this one's yours to take.
Yeah, I'll take it away. So just like Dr. Camejo had said, it's important to speak with your doctor so they can determine your BMI. So if your BMI is over 30, then you are in the obese range, but BMI only takes into account a person's weight and height. It does not take into account your total body composition. Athletes may have more muscle on their body than the average person, and muscle weighs more than fat. So while the BMI is a tool we currently use to categorize overweight and obese people, it's not the best indicator of how healthy a person is, since it does not include the full picture of someone's body. So like their muscle, their body fat percentage, their bone density, their activity status, or their dietary habits. All of those play a role.
That's fantastic feedback. Thank you, Dr. Mauricio. So we got an interesting question here. It's something I've completely forgotten about. Luisa's question is, Dr. Camejo, I have a question about these new wonder drugs. Are there any side effects? I'm asking because I remember my sister talking about some medication called Olestra, which gave her stomach cramps and horrible diarrhea. Oh my God, I remember Olestra. They put that stuff in fattening foods like the potato chips, like Lay's and Doritos, so you could eat as much as you want and not gain weight, but there was so many side effects to it. So, okay, what is Olestra? And what kind of side effects then do drugs like Ozempic or GLP-1s have?
Yeah, and Kathy, you're right on. Olestra was a synthetic fat that they would put in all those snacks back in the early 90s so that you could eat as much as you want, and they were all fat free. But the biggest problem was that your body couldn't absorb the molecule, and it caused many consumers to have horrible diarrhea, stomach cramps. It was pretty bad. Now, back in the 90s as well, because of that, they came out with another medication called Orlistat, which was the name of the medication that wouldn't let your body absorb fat. So it'd make you go to the bathroom all the time if you ate a fatty meal. But now the GLP-1s, I think, is really important for people to know what potential side effects they are going to face if they're going to take these medications. So I think we should post them as well. And really the number one, I would say the number one nausea medication that you would see is nausea. Nausea is one of the biggest ones that you have. You're also going to see diarrhea, constipation, sometimes vomiting, headache, heartburn, and fatigue. Now, those are the common side effects. There could be a few more here and there, but those are the ones people usually will experience during this. Now, there are ways we minimize the side effects is by starting these medication at a very low dose and titrating up every 4 weeks to see how you tolerate the meds. And also make sure to eat small, more frequent meals throughout the day and avoid fried or any greasy food, because nausea is usually the worst. So when you go too long without eating because you feel full, it's not good. So it's always important to eat little things constantly throughout the day, and it'll help manage those side effects.
Thank you, Dr. Camejo. Now, in case you missed it the first time, here's another opportunity to find out where to send in your questions.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Well, Instagram is representing today, and this one comes to us from Howie, who has a non-Ozempic question for Dr. Camejo. Hi, Doc. I know everyone's asking you about Ozempic or Zepbound today, but you know what? It's too damn expensive for this guy. I want to know if there are meds that have the opposite effect and cause you to gain weight. If so, which types are they, and what can I do to stop it? Okay, are you able to switch gears, Dr. Camejo, and get out of the GLP-1 zone and answer this one for Howie?
Actually, honestly, I wouldn't mind a little break, but great question, Howie. And you know what? This is right up Melissa's alley. Marissa, why don't you take this one?
Absolutely. So there's a list of common medications that can cause weight gain. I'm going to go over 5 of them. There's quite a few out there, but the top 5 that I typically see, number 1 would be diabetes medications. Like insulin, they can cause your body cells to absorb more sugar from your blood. And then your body in return will then convert that sugar into fat. And this can lead to about 5 to 10 pound weight gain. The second one would be antidepressants. So this is like SSRIs or TCAs, like amitriptyline, fluoxetine, or paroxetine. These ones can cause weight gain. Some antidepressants can cause it more than others. I would recommend discussing your medication options with your provider if you experience weight gain after starting an antidepressant. The third category is mood stabilizers. These are medications such as clozapine, lithium, or olanzapine, And these mood stabilizers or antipsychotic medications can directly affect the brain and stimulate a person's appetite, causing the weight gain and then affecting their metabolism. The fourth category would be beta blockers. So this is something like atenolol, propranolol, or metoprolol, for example. And these are often used to help people with chronic high blood pressure or other heart conditions. These medications can cause a person to gain, on average, about 2 to 3 pounds of weight within the first few months of treatment. It's best to consult your doctor for an alternative option to make sure, and also make sure that you're implementing healthy lifestyle choices. And the fifth category I would talk about is corticosteroids. So prednisone, dexamethasone, hydrocortisone, for example, long-term use of these types of steroids can lead to weight gain due to the increased cortisol levels, which is the stress hormone in the body. And this can enhance your appetite. So I would recommend limiting the use of the corticosteroids and then only using them for a short period of time. One thing to note, that if you're thinking your prescription medication is causing your weight gain, do not suddenly stop taking the medication without speaking to your doctor first.
That was a great question. Thank you so much. Okay, so the next question comes to us from Deborah, who reached out through YouTube. Dr. Camejo, I was at book club last week and I heard from one of the girls that she'd heard from one of her former members who'd been on the pill, was also taking Ozempic, ended up getting pregnant. Can it really happen, or is this just some urban legend? Okay, I've been hearing about Ozempic babies a lot, Dr. Camejo. So I want to know this as well. Is there some truth to this?
Deborah, good question. Another very difficult one. But yes, it is not an urban legend. You know, folks who are obese who want to get pregnant sometimes get put on these medications because it helps improve, obesity increases the risk of infertility. So optimal weight control can improve pregnancy outcomes. But Zepbound and Mounjaro may decrease the intended effect of an oral contraceptive due to delayed gastric emptying. So the problem is your oral contraceptives aren't always effective. And so it is recommended to use an additional barrier method like condoms while you're on these medications. Now, however, weight loss medications, I want to make sure people understand, they're not recommended during pregnancy due to safety issues. And it's not also recommended to try to conceive while you're on these medications due to lack of studies in this population. So if you want to do that, please stop your medication at least 1 to 2 months before trying to conceive. But it isn't an urban legend. People have gotten pregnant on these medications.
There you go, debunked. Okay, let's see what we got here. Okay, here's a Facebook question from Silvio for Dr. Camejo. Hey, doctor, like the guy before said, these new drugs are way too expensive. So will there be a generic version soon? And what about the over-the-counter stuff? Do they work, or is it just a scam? Okay, so he has a couple of really good questions here, especially about the over-the-counter stuff and those price points, Dr. Camejo. Can you share a little bit more about that?
Sure. And Sylvia, I appreciate the outreach. And trust me, I feel your pain on this. We get asked all this all the time. But, Marissa actually works a lot with patients in clinic, and she always gets asked this question. So I'm going to let Marissa take this one.
Yeah, this is a great question. So currently the GLP-1 medications, Zepbound, Saxenda, and Wegovy are currently under patent, meaning that they're only available by the brand name. However, drug makers are currently experiencing a nationwide shortage of these medications. And by law, these medications are able to be compounded at compounding pharmacies under the generic names. So these medications would still require a prescription, and I highly recommend discussing this option with your provider. It might be a better financial option for you, but you want to make sure that it's both safe and effective. Now, there is currently one FDA-approved OTC or over-the-counter medication, and it's called Ally. Dr. Camejo mentioned it earlier under the generic name Orlistat. And this one you can buy without a prescription at your local pharmacy. This medication, however, is only shown to have minimal weight loss, so about 3 to 5% of your weight loss from your baseline, and lots of side effects, including abdominal pain, greasy stools, gas, and diarrhea. So I would recommend discussing this option with your primary care provider prior to starting that and to make sure it's a right choice for you.
So Dr. Mauricio, just to jump in here quickly, are you saying that there may be generic brands in the future?
In the future, once the patent is completed, then I do think they will come out with generic versions of the medication.
Great, thank you. Okay, so Dr. Camejo, looks like we got another question from the gram. So this time it's from Wayne, and Wayne asks, "Hi, doctor. Let's say I came into some money and could actually afford Ozempic, Zepbound, or Mounjaro. How often do I need to see my doctor while I'm on the medication? Is it safe to use them long-term, or are there risks?" Again, two great questions. I'm loving this. I know some people that are on this new drugs, and I'm sure they don't know the answer to Wayne's questions. So what can you say?
Well, Kathy, I'm sure you're right. A lot of people just kind of jump into the pool without doing much research here. So excellent question, Wayne. But before I answer your question, let's check out an informative video from our friends at the Mayo Clinic.
It's a medication called semaglutide, better known by the brand names Ozempic and Wegovy. Ozempic is approved by the Food and Drug Administration to treat type 2 diabetes. Wegovy is now approved to help with weight loss.
These drugs have been shown to help people lose, on average, about 15% of their body weight.
It works by tricking your brain and stomach into feeling full so you don't overeat.
It's really changed how we think about these weight loss medications.
It's a prescription medication. The FDA advises it only for people with a body mass index or BMI greater than 30, or a BMI of 27 or more with a weight-related health condition. A common side effect is nausea.
These are injections, and you give them once a week to yourself. Typically in the belly, so much like an insulin injection would be.
They're also expensive and oftentimes not covered by insurance, so check with your provider.
I think it's a great tool. I think for a lot of people, it certainly makes a significant difference to how they feel about food and how they feel about their own hunger signals and their ability to control that, and that's very powerful.
So Wayne, you'll need to at least visit your doctor monthly, as the medications need to be dose adjusted every 4 weeks until you get into a maintenance dose. But Marissa, is there anything you'd like to add to this question?
Yeah, so when you start a weight loss medication, it's important to understand your baseline weight and your labs to assess your current state of health. And then you may need to repeat these after 3 to 6 months of being on the medication to monitor your changes. It's also beneficial to create SMART goals, including exercise and nutrition, and making sure that you update your progress with your provider so that you are experiencing the behavior change and getting the most out of your medication while you're on the weight loss journey.
Thank you, Dr. Mauricio. Now, if you got questions, you know the drill, we've got answers. And in case you missed it the first couple of times, here's yet another chance to find out where to send in your questions.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
All right, finally, a brave soul has stepped up and is asking the hard questions, and it comes from Heidi on YouTube. Dr. Camejo, not to come off as judgmental, but I can't believe nobody's asked these two most important questions. So I guess it's up to me. How much do these medications cost? And are they covered by Medicare and insurance? I couldn't be prouder, Heidi. You go, girl. Let's find out how much these medications cost.
Well, you know, Heidi, unfortunately, the injectable weight loss medications are very costly. Wegovy runs about $1,300 a month, and Zepbound is about $1,000 a month. But both Wegovy and Zepbound have saving cards that are given by the manufacturer that could be used at the pharmacy to cut the cost down to about $500 if your insurance doesn't cover it. Now, just like the commercial, like the video before said, most commercial insurance don't cover weight loss medications because unfortunately, obesity is not considered a chronic disease in our country, according to insurance plans, but check with your plan. Some plans do cover it. Now, Medicare will now cover Wegovy for its new indication if the patient has had a history of a heart attack, a stroke, or peripheral artery disease, and they're overweight or obese. And Medicaid currently does not cover any of these weight loss medications.
Okay, so it looks like we have time for at least one more question, and it's from Clarice on Instagram. And her question is, "Hi, Dr. Camejo, do I need to follow a particular diet if I'm on these diabetic medications? And how soon should I expect to see results?"
So, Marissa, you're counseling patients in clinic, and I know you're seeing a lot of patients with results every day. What would be your recommendations?
Yeah. For the expectations for weight loss, we typically shoot for 1 to 2 pounds of weight loss per week. Each person really responds to the medication differently, so it really depends on what they're doing and making sure that they're following the lifestyle modifications as well while they're on the medication. So implementing a 500 calorie reduced diet that focuses on nutrient dense foods may help you reach your weight loss goals. And that includes a diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats. The Mediterranean diet is a great guide to follow. Additionally, if you want to focus on your portion control and then aim for well-balanced meals. Staying hydrated and drinking plenty of water throughout the day will also help you maintain that feeling of fullness and support your bodily function. And then you don't necessarily have to cut anything out of your diet, but you do want to be more mindful of the foods that you eat and limit your added sugars, your processed foods, sweetened beverages, and alcohol. It's important to follow the guidance of your provider, and you may want to work closely with a registered dietitian, nutritionist, or a wellness coach.
Thank you, Dr. Mauricio. Now, I actually have questions. I jotted them down. So I'm, as a host, I still have questions for the pharmacist. So thank you so much for answering these ahead of time. So let's talk about this. This is so the weight loss medications, do they interact with other prescriptions? Or if you have like another health condition, as you were talking about earlier, does that happen?
I can take this one. So yeah, that definitely does happen. That's why it's so important to talk with your provider to see if weight loss medications are right for you. And that way you can determine which one would be right for you. So some medications can interact if you have other conditions like a heart condition, for example, because they might have side effects that increase your heart rate or your blood pressure. And so you wouldn't want to use one of those medication options in someone who has that past medical history. And then you also want to make sure that you're checking the other medications that you're on to make sure there's no duplicate side effects that you may experience from those medications.
Thank you, Dr. Mauricio. I have one more. And when we go to our pharmacists, obviously, we love asking questions to our pharmacists. So are they able to help us if we have any questions about our weight loss journey, about how to properly use the medication?
Well, pharmacists are a great wealth of knowledge. They really know how to do a lot of stuff, especially in wellness areas as well. If you're not sure, go talk to your pharmacist who you normally go see to pick up for your medications from.
Right.
They have a great knowledge. They're really well-rounded. And Marissa, I know you counsel a lot of these patients in wellness. And what are some of the wellness things that you're doing in your clinic to help these patients improve and help lose weights with these medications?
So like we talked about earlier, there's a lot of side effects that may potentially be experienced with the medication. So as a pharmacist, I'm able to help my patients. They can, call me or come to the pharmacy directly if they want to speak with a pharmacist there. And we can help with mitigating those side effects. So if they're experiencing nausea, we can ask them, what kind of foods are you eating? How often are you eating? And make those recommendations to help prevent those side effects from returning. So a lot of times it's about the food that can definitely play a big role in the side effects that they may be experiencing. It can also help with keeping you accountable, making sure that your prescription is affordable, whether it's going through the insurance, or we can help you find a coupon to help pay for the medication. Pharmacists have like you said, a wealth of knowledge that we can provide. So definitely don't feel afraid to reach out to your local pharmacist.
We actually have time for one more question, and we got one from IG again, from Instagram, and this one comes from Eric. Do I need to be on these medications long term? That's actually a great question. We didn't hear about that.
So I would say, as long as you're on the medications, this is a big thing. The most important thing is, why did you get on the medication? You want to lose weight. But even though these medications help you lose weight, the most important thing is that you really need to focus on changing your lifestyle. Because what happens is, after a long term, is you might want to get off the meds, and sometimes insurance don't cover it for too long either. But this way, once you've lost your goal weight, you should be thinking of changing your behavior and how you eat. And I would say, If you do that, then you shouldn't have to be on these medications for a very long term. Now, it also depends on how much weight you have to lose. But I think the most important thing is while you're on these medications that are helping you lose the weight, change your lifestyle, exercise, do a lot of much more things that you can be mindful of so that you can help keep the weight that you've lost. Marissa, is there anything you'd like to add on that?
Yeah, great response. I think the only thing I would add is that some of the medications are meant to be used for a short-term period. So for example, phentermine, that one's typically like a short-term option, about 3 months, versus your GLP-1 medications, which are typically more of a long-term treatment. And working closely with your provider or your pharmacist will really help you in understanding realistic expectations of how long you may need to be on that medication.
Thank you so much, Dr. Mauricio. This is so helpful. Again, that's all the time we have for today. I wish we had more, but guess what? We'll be back next week. I'm Kathy Buccio, and I'll see you next time on Ask the Doc.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.